Hello, I'm Sai Bhavya. I'm working on a project, heart disease prediction using machine learning techniques. Heart diseases are life threatening and may sometimes cause death. Heart diseases involve narrow or blocked blood vessels that can lead to heart attack. Some of the blood vessel diseases are like coronary artery diseases and heart rhythm problems. Heart diseases are commonly caused and, when neglected on large scale, can become life threatening. So, early detection of the disease is very important for diagnosis. There, there can be many parameters that are to be considered for heart disease prediction. Some of them are like age, cholesterol, blood pressure, blood sugar levels, etc. The main objective of the project is to predict the heart disease using machine learning techniques so that preventive measures and medication can be taken to avoid risk. The outcome of the project is to build an efficient ML model that can be used for heart disease prediction. The dataset that is used in this project is Cleveland dataset, which consists of 303 instances of 14 different attributes. The attributes are like age, sex, and chest pain type, which has 4 different values, where 0 represents typical angina that causes squeezing of blood vessels in the heart, and 1 represents atypical angina, which causes the pain at the muscular region, and 2 represents the pain at the bone, and 3 represents asymptomatic. Next attribute is resting blood pressure, which gives the systolic blood pressure, whose normal range is around 120 mg per dl. And next is cholesterol level, uh, whose normal range is 200 to 239 mg per dl. And the next attribute is fasting blood sugar level, which consists of 2 different values, 0 and 1, where 1 represents the blood sugar levels greater than 120 mg per dl. Next is resting ECG, which consists of 2 different values, 0 and 1, where 1 represents abnormality in the curve and 0 represents the normal curve. And the next attribute is the maximum heart rate that is achieved. And the next is exercise-induced angina, which consists of 2 different values, 0 and 1, where 1 represents that angina is caused by exercising. Old peak and slope are the 2 different attributes that are related to the ST segment of ECG curve, where old peak gives the depression of the ST segment in the ECG curve, and slope has 3 different values, 0, 1, and 2, where 0 represents the flat curve, and 1 represents upsloping, and 2 represents downsloping. CA gives the maximum number of blood vessels that are colored by fluoroscopy. Fluoroscopy is used to monitor the flow of blood and also to detect the heart rhythm problems. And the next column gives the level of thalassemia disease. It can be of different levels, where 3 is the normal level and 7 is abnormal. And the final attribute is target variable, which consists of 2 different values, 0 and 1, where 1 represents the deceased patient and 0 represents the healthy heart. This is the ML model. Outline of the ML model is given by this. At first, the training data, which consists of features such as age, BP, blood sugar, and cholesterol, and the label, which consists of target variable, that is 0 or 1, is fed as input to a particular machine learning algorithm. In this project, we are using 4 different machine learning algorithms like Bayes, decision tree, k nearest neighbors, and random forest. The machine learning algorithm generates a model that is capable of predicting the output. Uh, the output of the model can be 0 or 1, where 1 represents the existence of heart disease and 0 represents the healthy heart. The hardware and software requirements are like uh, it requires 4 GB RAM and 40 GB hard disk space. And the software requirements are we are implementing the project with Python 3.8 by using sklearn package and also Jupyter Notebook from Anaconda software. This gives the timeline of the project. Thank you.